Hi, my name is Gabrielle Nixon. I am going to talk to you about the core values assignment. The core value assignment asked us to do multiple things. One was to um, learn about the story about Miss McMath, a young girl who went into the hospital to have her tonsils removed and ending up brain dead. And then also to talk about our core values and how those core values can affect our decisions. So, looking at the core values, I was at a meeting, asked one of the managers at the meeting if she wouldn't mind filling out the questionnaire. Well, it turned into a big conversation among multiple managers. I had each one of them fill out the questionnaire to see what their core values would be. It's amazing that all of us had the same core value of family. The other core value, the second most important core value to us, varied. It varied from love, peace, integrity, which was mine, and then I believe also wisdom was the other one. So love, peace, wisdom, and then mine, integrity. Um, so when we got through with that, I had already read and listened to the story about Miss McMath, the young girl who went in to have her tonsils removed, and how her family reacted. I had to do a lot of self-reflecting. Once I listened to it, I had heard the story years ago and forgot all about the little girl that her family took to court to asking to keep the child on life support when the hospital was saying we need to take her off. Even after multiple doctors had said she's brain dead. And why that was hard for me and difficult is because I have well, my children are no longer young, but I've gone through multiple procedures with my children when they were younger, and I don't know how I would have handled that if I would have had the inner strength to be able to say, even after doctors had told me and assured me she was brain dead, would I be able to do that? And to be honest with you, I don't think that I could. And I think the reason for that is one of my core values is family, and family is very important to me. And as a mother, we will move heaven and earth for our children. And I would probably be praying for a miracle. So, with that being said, I did look at also, it asked us about the two of the nurse executive competencies and two of the ANA scope and standards that we thought might be challenged when values serve as the basis of making care decisions. So for me, the two that I picked from the nurse executive was communication and relationship building. And I said that because under the relationship management, it mentions collaborative relationships with staff, physicians, and other disciplinaries. And I do believe those can be damaged, especially when you're unable to come to agreement or the best course of treatment for a patient. So I think sometimes that relationship can be a little damaged. We've all seen the conversations between doctors and nurses or other disciplinaries, or even two doctors where they fail to agree on a treatment plan. So I believe that to be true. The second one would be knowledge of healthcare environment. And under that, it talks about healthcare economics. So I thought about it, and almost similar to the McMath, are we exhausting resources and finances that we could use for another patient? And not just hospital finances, but also the family's finances, because keeping Miss McMath on life support, I'm sure, is financially draining to the family as well as to the hospital. And then the question is it futile care? Are we doing or prolonging life that we shouldn't be spending money on? And I don't say that lightly, but that's probably some of the conversations that occurred when they spoke about Miss McMath. Under the ANA Code of Ethics, the two I chose, one was the right to self-determination. And the reason I picked that one is because every patient should have the right to determine or to decide what is right for them once all the information is given. So I feel like I know Miss McMath, the patient, was not able to make those decisions for herself because she was brain dead. But the mother and the family should have been able to make decisions as far as the care for their daughter. And that right seemed to be taken away from them simply because the doctors felt like they knew what was best. So that was one that I also felt could have been, but could be, what's the word I'm looking for? Could be challenged by our core values, because what I think is right may not be what the patient would have thought was right. And we have no idea what this young lady would have wanted if she had found out that she was, or if she knew that was a possibility. Would she want to be kept on life support, or would she not? The nice thing now about having self-determination is that we have living wills in which we can make those decisions for ourselves. The second one in the ANA Code of Ethics, I thought also was a collaboration of human rights and complex, extreme or extraordinary practice settings. And one of the reasons I chose that is because of thinking back, watching about the hurricanes and thinking back on Katrina, when nurses were in a setting where they had to make decisions, and they were life and death decisions for patients. And some of the decisions that those nurses made were based on their core values, what was important to them. There were nurses that abandoned patients because they valued other things, and then there were those who stayed and provided excellent care, or the best care they possibly could for patients. So that was the other one that I thought of as far as which one is on our core values. So the last thing we were asked to do also was to look at how to build a diverse and workforce. So I looked at an article that was actually called How to Build a Diverse and Inclusive Nursing Workforce. There were several things that the article spoke on, which I really enjoyed. One was identifying kids at an early age that would end up being good nurses. So the nurse that wrote the article stated that we need to reach kids in junior high school and senior high school, especially large populations of, they have large populations of Hispanic and African American students that might be interested in nursing. And then also encouraging those students to become involved in academic support programs that could help them succeed in the nursing program. The article also spoke about having more minority faculty members in nursing programs. Currently, according to the article that was written last year, only 14% of academic faculty are actually minorities, which is a pretty low number. And looking and thinking about it, when I was in nursing school, I don't really remember having that many minority nursing instructors, or even being able to see peers that were similar or who looked like me. So I thought that was very important. And also they talked about empowering nurses to become involved in the community and involved in community outreach, which is very important, mainly because if you have nurses that are minority nurses out in the community, children or adults can see that someone that looks like them is a nurse and may encourage them to become a nurse. So I think it's important to give back to the community as well. The only thing about the article that I did not like was the simple fact that it did not address the male population. I think it's important that men are influenced to go into the nursing program. So I would have liked to have seen that incorporated in, because that is part of diversity. And diversifying nursing, we need males, we need blacks, we need Hispanics, Latinos. It's important that we have a good representation of what our community looks like in the nursing profession. So I look forward to hearing what everyone has written, and then also everyone's blog. Thank you for listening. Have a good day.